economies prosper, and new wealth leads to decent jobs for everyone.
And we will live in a world where all our industries, our infrastructure, and our best innovations are not just used to make money, but to make all our lives better.
We will live in a world where prejudices and extremes of inequality are defeated, inside our countries and between different countries.
We will live in a world where people live in the cities and communities that are safe and support everyone who lives in them.
We will live in a world where we replace what we consume, a planet where we put back what we take out of the earth.
We will live in a world that is decisively rolling back the threat of climate change.
We will live in a world that will restore and protect the life in our oceans and seas.
We will live in a world where we restore and protect life on land, the animals, the forests, the earth itself.
We will live in a world with peace between and inside countries, where all governments are open and answer to us for what they do at home and abroad, and justice rules with everyone equal before the law.
And we must live in a world where all countries, including Jamaica,
and we, their people, work together in partnerships
of all kinds to make these global goals a reality
for everyone, everywhere, every Jamaican.
This is the plan. Let's get to work. Let's make it happen. To achieve the Jamaica we want. Vision 2030, Jamaica, advancing the SDGs, leaving no one behind.
Three factors can help you make safe choices when you're in an area of widespread COVID-19 transmission. Consider the location, the proximity to others, and the amount of time you spend there. Where does your activity take place? Open-air spaces are always safer than enclosed spaces, particularly if they're small or without fresh air. Proximity to other people is also important. It's safest when there are fewer people around and you can keep more than 1 meter apart. How long does your activity last? The shorter, the better. Think about each of these factors and avoid situations where the risk dial is high. Small or poorly ventilated places and crowds of people for long periods of time. Stay safe. Lower the risk to yourself and others.
Whether you're a small farmer, street vendor, big investor, every entrepreneur, you got to wise up about your money. You have to make sure say your money secure. When you need to grow, you have access to more.
Financial inclusion means that individuals and businesses have access to useful and affordable financial products and services that meet their needs.
Access to more money, more credit, whatever your business needs. When you work hard for your money must work for you.
Reduce your risk of viral illnesses like the flu and coronavirus. Wash your hands frequently with soap and water. Cover your nose and mouth when coughing with a tissue and dispose of it. Avoid close contact with anyone with the cold or flu-like symptoms. If you think you've been exposed to COVID-19, stay home. Self-isolate immediately and call 888-1-LOVE. That's 888-663-5683. A message from the Ministry of Health and Wellness.
Hi, I'm Christopher Tufton, Minister of Health and Wellness. Vaccination has always been a critical part of protecting the health of our Jamaican people. The more of us who get vaccinated, the greater our chances of slowing the spread of COVID-19. The COVID-19 vaccine now available to Jamaica has met all the required safety and quality standards. I will take the vaccine, so let's vaccinate to stay safe.
A message from the Ministry of Health and Wellness.
The next person in line, your friend at school or your co-worker, may have COVID-19 and not know because they have no symptoms. You, on the other hand, could be hospitalized for 2 months or more if you become infected. Is it worth it? Stay so.
Online with us is our Director of Family Health, Dr. Melody Ennis, Mr. Jasford Gabriel, President of the Jamaica Teachers Association, and Mr. Clifton Reeder, President of the Jamaica Hotel and Tourist Association. At this point, I hand over to our Minister.
Thank you very much. Good evening, ladies and gentlemen. Let me welcome you all for being here at another COVID conversation. The usual suspects are here, were introduced earlier, but I want to just specially recognize the President of the JTA and the JHTA, who we will speak with momentarily. In the interest of time, and we apologize for the 20 minutes delay, I'm going to ask our Chief Medical Officer to go right into the COVID update, and then we move on to looking at a vaccination update. CMO.
Thank you, Minister. Good evening, everyone. Let's follow the slides. Next slide. Okay, so we confirmed 204 new cases yesterday, which brings our total number of cases up to 41,604 cases. We also confirmed 646 deaths that we thought were related to COVID. So we have a daily positivity rate yesterday of 19.6% and a cumulative positivity rate of 14%. Next slide. Okay. All right. We just want to remind our viewers about the risk factors and the comorbidities. With this slide, where 98% of the COVID-19 related deaths had one or more comorbidity or risk factor. And chief among this was age 60 and older, where we had 473 deaths. And our chief comorbid illnesses that were implicated: cardiovascular disease, diabetes, chronic kidney disease, chronic neurological disease, and cancers, asthma, obesity, chronic lung disease, and HIV or other immunodeficiency. So just again to say where we're focusing in terms of our vaccination for the age 60 and older, because it is the greatest risk factor that we have for poor outcomes. Next slide. This just gives us an idea where we are now in terms of the communities that are affected across the country. And you can see that in all parishes, most communities are affected. Next slide. Looking at our epidemiological curve, many persons will be pleased to see that we have a downward trend at the end of the curve. The blue gives us our absolute numbers. Over the last few days, you would have seen a decline in the number of testing, and that is coming out of the hospital, the holiday season. From Holy Thursday until Easter Monday, we would have a decrease in the number of samples that were taken, and so we would see a decrease in the overall numbers of testing that were there. So we may find that over the days to come that the end part of that curve may go up a bit, but we certainly believe that we are trending down. Next slide. Looking at the positivity rate, that gives us a better idea of what is happening in the country. We can see that more of the plateauing that we would expect at this time. So we would have in the green line on the graph, you will see that about the week 11, about the 8th of March or thereabouts, we had a peak in the number, in the positivity rate, and then we have been having a bit of a plateauing since then. Next slide. When we look at the number of deaths, you would have seen that for March, we would have reported a number of deaths, again with a peak about in the middle of March. When we look at the overall deaths and compare it to what we are expecting to see, we have received the numbers, preliminary numbers from the RGD for 2020, and so in the blue we have the numbers of deaths, the actual numbers of deaths that there were for 2020 per month. We would see that the brown line would be the mean over the last 5 years that we would expect, and we would have seen that where we had peaked in the number of COVID cases and the number of COVID deaths in August, September last year, we would have had more than our expected number of deaths. So for this year, now that in March we are seeing an increase in the number of COVID-related deaths, we expect that when we get the overall numbers, that it would probably be over the mean that is expected for this year. In looking at our hospitalizations, the red line gives us the number of beds that we have. You would have seen that that would have increased over time. The blue gives us the actual hospitalizations, meaning the number of persons confirmed and suspected cases of COVID that are on hospital beds. We would have seen again in the first week of March that we would have peaked, and we have seen a gradual decline in the number of hospitalizations. We're still, however, not below the red line, which is where we want to get to quickly, and certainly to get even much lower than that. The yellow line on the blue gives us our number of admissions, and we would also have seen that since the first week in March, we have seen a steady decline in the number of admissions per week. So these are good signs that we are seeing here, and these, we believe, are coming out of the restrictions that were imposed from as early as February. Now, to get us below the red line very, very quickly, we would have introduced new restrictions as of the 22nd, 23rd of March, and we're expecting that over the next couple of days, weeks, few weeks, that we would get that blue lines down. This is the weekly positivity rate that we are looking at. And again, you would see the peak at 38.9 on the red. And that occurred about the first week in March, and we have been seeing a decline since then. For this week so far, our positivity rate is at 33.3%. And by the end of the week, then we will see if we will continue with that downward trend or plateauing of the positivity rate. This is our reproductive rate, and we have some good news because we have been saying that we need to get the reproductive rate below 1, and we now are at 0.9. Now, you would recall on that first week in February, we were at 1.3. Since then, that was about February the 8th. Since then, we would have introduced the increased curfew hours about February the 10th, and then we would have increased the gathering restrictions February the 24th. All in an effort to decrease movement, decrease exposure, and we would have seen that gradually dropping down to 1.1 and then to 1. And now we have increased the restrictions even more because we need to get it quickly down to as low as 0.7. So we are at 0.9 now. And again, this speaks to the decrease in movement that we need to see, decreased risks of exposures. We can go on to the next slide. And just to show you what it means if we can keep the reproductive rate below 1. So at 0.9, what we're expecting to see now in another 30 days is a decrease in the number of cases. When we were at 1, we expected that the number of cases would remain about the same. At 0.9, we expect to see a downward trend. And certainly if we get it down to 0.7, then we would be more where we want to be in the green zone here, where we, in another 30 days or so, we'd be expecting our numbers to be below 100. So in summary, we have seen a decline in the positivity rate. We have seen a decline in the reproductive rate, and we have seen a decline in hospitalizations. But these declines that we are seeing is early. It's early, and we cannot, jump up for joy now, because we really need to tighten up to get the numbers down more. Even though we have seen a decline in positivity rate, and we see that that's about maybe about 30%. Remember that where we want to get to be is 5%. So there's a lot of way to go. So in terms of we believe that this is a direct result of the restrictions imposed that have decreased the movements, and we believe that the restrictions should continue to solidify the downward movement. The expectation is that with vaccination of our vulnerable population by the end of June, that we can more expect at that time to see a sustained decrease in the hospitalizations. Next. However, we do face some risk of that not happening if there is decreased compliance during the period between the vaccines. Please remember that after the first vaccine, there is a low efficacy rate. It's just a small reduction in the number of cases that you would see if you had never taken the vaccine. So persons must maintain their precautions. If it is that there is still a risk of infection, then our vulnerable groups, if they decrease their precautions, then they are likely to become infected, and this would certainly prevent what we expect to happen in terms of decrease in numbers and decrease in hospitalizations. So everybody must continue with their precautions. Another risk that we face is poor take-up of the vaccine by our vulnerable groups. Now, we know that persons have been coming out, but we still need persons to come out more to ensure that everybody gets the vaccine. At least 65% of each of the target groups need to get the vaccine. We also have a risk that there could be importation of variant strains from other countries, but also within country, if our numbers continue to increase, the more positive cases you have is a more multiplication of the virus and the more opportunity for mutations. So that is another risk that we face as well. We also run the risk, of course, that as we vaccinate more people, then persons become more complacent and start to continue with normal activity and therefore increase in risk of exposure. Next slide. So therefore, we are asking the population to continue the use of mask wearing, physical distancing, hand washing, staying home if you're sick, reduce your exposure risk by avoiding gatherings for 2021, continue our restrictions with the curfews. We're going to continue quarantine rules until at least 60% of the population is immunized. We as a ministry continue to monitor the events in other countries, and we also are encouraging the population to take personal responsibility by boosting your immune status by eating healthy, exercising, and managing stress. We're also encouraging the population to be compliant with managing disorders in particular, your non-communicable chronic diseases such as diabetes, hypertension, heart disease, kidney disease, because we do not want, once we have protected this vulnerable group, that we end up with the other age groups becoming at risk because they are non-compliant with managing their disorders. I just want to say a brief word on adverse events because I know it is a topical issue now, a lot in the media. And I just want to remind the public that in vaccination campaigns, such as the current one for COVID-19, it is customary for countries to report potential adverse effects following immunization. While this does not necessarily mean that such events are related to the vaccination itself, they must be investigated. It also shows that the surveillance system is working and that effective controls are in place. The World Health Organization is in regular contact with regulatory authorities around the world, including the European Medical Agency, to obtain the most recent information on the safety of all COVID-19 vaccines. And the committee that monitors this from the WHO is the WHO Global Advisory Committee on Vaccine Safety. In March, we would have noticed that there were reports in Europe of coagulation disorders potentially related to administration of the AstraZeneca vaccine. The WHO Advisory Committee and the Risk Assessment Committee, PRAC, of the European medical agencies have been assessing over time the available safety data on the AstraZeneca vaccine. And they had concluded that the vaccine is not necessarily associated with an increase in the overall risk of blood clots, which are thromboembolic pulmonary and deep vein thrombosis events. Now, and this is if we had mentioned before that the usual incidence of venous thromboembolism in Europe is usually about 1 to 2 per 1,000. And we would see that what we are seeing now is an estimate of 1 in 150,000, in some instances 1 in 100,000 incidents of these blood clots occurring in persons who would have received the vaccine. Next slide. So in April, in a total vaccinated population of 34,169 cases of DVT, which is deep vein thrombosis, and 53 of superficial venous thrombosis have been reported in Europe, which is a 1 in 150,000 incidence. And this is just to point out that this is a very rare event that is happening in persons that have been vaccinated, and certainly lower than that would have happened in the normal population, where you see 1 to 2 per 1,000. Now, the World Health Organization has emphasized that although it is plausible that these events could be linked to the vaccine, this has not been confirmed, and additional specialized studies are needed in order to better characterize the potential association between vaccination and risk factors. COVID-19 is associated with a risk of hospitalization and death. And globally to date, 134 million people were confirmed to have COVID-19, of which 2.9 million people have died. Approximately 200 million individuals have received the AstraZeneca COVID-19 vaccine, with 146 reports of the very rare events of blood clots with low platelets. In Jamaica, it should be noted that as of today, 41,000 persons were diagnosed with COVID-19, of which 646 have died. As of April the 7th, over 47,000 persons were vaccinated with the AstraZeneca vaccine, of which there has been no report of this very rare event of blood clots with low platelets. So based on the available information, the WHO and the European Medical Agency currently consider that the benefits of the AstraZeneca vaccine far outweighs the risk, given the risk of morbidity and mortality from COVID-19, and recommend that the vaccinations continue. Therefore, we are considering that the benefits of the vaccine outweighs the risk. PAHO WHO recommends that all countries continue to use the AstraZeneca vaccine to fight COVID-19 while the above-mentioned events are investigated. It furthermore recommends that the safety of all COVID-19 vaccines be monitored and that the reporting and investigation of presumed adverse events be encouraged. Patients should seek immediate medical care if, especially within the 4 to 20 days following vaccination, they have any problems such as difficulty breathing, chest pain, inflammation in the legs, persistent abdominal pain, neurological symptoms, or small spots of blood under the skin beyond the injection site. And these are events that you can have with or without COVID vaccination. But if you have any of these events, you should report immediately to your doctor. And that's our recommendation from the Ministry of Health and Wellness as well.
Okay, thank you very much, CMO. A lot has been said, and I know it will take a little time for you to digest all of that, but we'll entertain questions after. I think the important note is that, one, we are seeing a decline in hospitalization, a decline in positivity rate, a decline in reproductive rate below 1%, and also the important note that our vulnerable groups, majority of our deaths are over 60 with comorbidities. So it's important that we recognize and encourage those who are in that category. So there is some encouraging news coming out of increased compliance and increased restrictions, and we want to thank the country for really, supporting the measures that have been implemented, including the long weekend, holiday weekend, which I think for the most part saw a lot of compliance. We're going to move quickly into the vaccination update. As said by the CMO, We've had, effective April 7th, some 47,708 persons in Jamaica receiving the first dose of the COVID-19 vaccine manufactured by AstraZeneca. The figure represents some 96% of the target that was set. That's 47,650 for month 1 of our national vaccine efforts. The majority of persons vaccinated to date are 70 years and older, representing some 20.7%, followed by persons in the 60 to 69 age group. And the majority of persons vaccinated so far from the KSA area, Kingston and St. Andrews, 29.7%, then St. Catherine, 18.4%, St. James, 9.8%, Clarendon, Manchester, St. Anne and St. Elizabeth follow in just under 7%, respectively. Of the vaccination of our healthcare workers, we have exceeded our target, and we're happy that this is the case. We had a target of some 15,000 workers in the healthcare system, and to date we have seen some 16,875, or 113% of target, taking up the vaccines. Before we get to the most current status of the registration and the blitz coming up this weekend, I want now to ask Melody Ennis, Dr. Ennis, who's head of our immunization program as head of family medicine, to quickly give us an update on the vaccine plan and where we are. Dr. Ennis?
Thank you very much, and good evening, all. We are at this time say that our vaccination program, as Minister is achieving high 90s, and we will be able to continue that because we have indeed received the well-anticipated 35,000 doses of the Covishield AstraZeneca vaccine from the African Medical Enterprise platform. And that vaccine arrived today and we have started actually the distribution to the regions. And that is certainly in preparation for our blitz activities, which will be taking place come tomorrow in some areas and to extend until Tuesday. So we're having high activities tomorrow and Tuesday. The areas that will be engaged in SAFE will be advertised, and our platform for registration will also be open as of
Dr. Ennis, we're not hearing you very clearly. Can you maintain a distance, a close distance from the speakerphone, and let's see if the sound comes across better, please.
Is that any better, sir? I'm hearing an echo.
Yes, it's a little better now.
Wow. Let me go even further away. Still poor. All right, so I really want to say, this is still at poor feedback.
We seem to be having a difficulty, Dr. Ennis. Let's try and work that out. Let's try and work that out and move on, and see if it gets any better. I'll ask the engineers to make contact and see if it can be worked out, because it's breaking up. All right. So, but thank you very much. Okay. So, just to continue while we try to sort that out, in terms of the vaccination blitz for this weekend and beyond. As of today, 10 a.m., April 8th, the priority group of persons for vaccination have been extended, and we've been taking appointments by a number of different ways. So persons 60 years and over, we've moved now from 75 down to 60 years and over. We've also included workers in the tourism industry, as well as teachers and other employees of education institutions, members of the Department of Correctional Services, the Jamaica Fire Brigade, the Passport, Immigration and Citizenship Agency, and Jamaica Customs. So we have added this new group and age cohort in addition to what the numbers and the groups that already were being vaccinated. So if you're a police or a soldier, JDF or JCF or a healthcare worker who missed the time that you were the priority, you are still the priority and you still can make an appointment. If you're over 75, you can still make an appointment. What we're doing now is just adding some additional groups to the group that has been there originally. What this means is that you can all, these categories of persons can now make appointments to attend a vaccination blitz site this weekend, and persons from among this group who wish to be vaccinated can make appointments two ways in particular. One is to contact the vaccination center at 888-1-LOVE or 888-663-5683, or book your appointment online at www.moh.gov.jm. That's www.moh.gov.jm, or book your or call 888-663-5683. You can assist someone who needs help, and we want to encourage that. So you can ask a friend, a relative, or a healthcare provider to assist with booking you for this appointment. We begin our third vaccination blitz operation starting tomorrow, April 9th, and this will run until Tuesday, April 13th. So between tomorrow, Friday, and Tuesday of next week, we will establish a number of blitz sites around the country, right across the length and breadth of the country, strategic locations, and these sites will operate from 9 a.m. to 4 p.m. In fact, we have 44 sites that have been set up or are being set up to accommodate vaccination programs across the country. You may recall that we had over 2 weekends on a Saturday, 2 blitz exercises, and this took place at the National Arena, and we saw some 1,700 persons being vaccinated, primarily in the 75 and over age group. And so we learned a lot from that experience, and we're now moving to ensuring that we move now to a national rollout, which is very important because clearly it is our intention to get as many persons as possible vaccinated to achieve the herd immunity that is so critical. I want to say that, let me give you some of the sites that are maybe common to you and based on where you reside. In Portland, we have the Port Antonio High School. We have the Claude Stewart Park in St. Mary, the Baye Resort in St. Anne, the Montego Bay Convention Center in St. James, Lucy Parish Church in Hanover, the Sean Levery Hall in Westmoreland, Independence Park in Black River, St. Elizabeth, the Denby Showground in Clarendon, the Manchester High School in Mandeville, Manchester, the National Arena continues to be a site that's here in the KSA area, the Portmore Heart Academy in St. Catherine, the Morant Bay Health Center in St. Thomas, and there are several other sites, as I say, 44. Now, it's not that important for you to remember the sites. What is important is for you to make the appointment, because once you call that 888 number, that's 888-663-5686, they will assign you a time and a site that is closest to you. So they will say to you, you are closest to the Port Antonio High School in Portland, you go to that site at 12 o'clock or 9 o'clock or 3 o'clock as the case may be. If you're closer to the Lucy Parish Church in Hanover, they'll say it. So it's difficult to remember all the sites. What's important is that you have a site close enough to you that the appointment scheduling will recognize and will assign, and you get that information. So call that number or go online, and please help a friend if you will. In that regard, I want to also say that our national mobilization efforts will depend also on efforts from our political representatives, our members of parliament, our councillors. You will recall I spoke recently around the role that my colleague, Minister of Local Government and Rural Development, Desmond McKenzie, would play to assist in the mobilization. And he has been reaching out through the municipal authorities, the mayors, to the councillors. They have been assigned some targets and are being encouraged to encourage those who fall in that 60 years and over, and indeed to assist in the mobilization to get those persons out. And I want to thank Minister McKenzie and his team, and also our mayors and councillors, the municipal authorities, for the role that they are playing and will play over the next 4 weeks, starting this weekend. In addition to that, our members of parliament have also been asked to assist in the mobilization, utilizing their political organization, and they will also assist in identifying persons and giving support. The electoral office is also playing a role. They will provide a list of the 60 and over to these representatives at the municipal level as well as at the constituency level for support, and therefore these individuals can be easily identified, to be encouraged, and indeed to be given support, mobilization or logistic support to come out. We have spoken to the church and we have encouraged them to play a key role in encouraging their members, to helping those who need to be signed up. And we want to thank the church for playing an important role in endorsing and supporting the vaccine program. And we have reached out to other community-based organizations, the neighborhood watches and so on, to play a role. So this is truly a national effort. This is how we want it to be seen. It is irrespective of class, color, or creed, of political leaning. It is about life. It is about a program to overcome a threat to our society and to all of us as Jamaicans and to life as we know it. And in this instance, we are asking, we are pleading, we are encouraging a unified approach. Help those who can't help themselves. Help them to get registered. Help to bring them out. And we want as many persons as possible this weekend at that location near you. And finally, the healthcare team who are doing the work, who will be working long hours this weekend. And indeed, over the next 4 days, we would like to see our public health infrastructure at all levels, particularly at the primary level, health centers, the blitz sites, focus primarily on the vaccine program, the COVID-19 vaccine program. Indeed, we are issuing a directive to minimize other services, not life-saving services clearly, but other services that would traditionally be provided in these health centers, and focusing almost exclusively on getting this blitz, this national rollout, making it a success. And that involves working with those who are mobilizing, encouraging others to come out, and facilitating or accommodating all those who come. Even if they're not registered, we would have to do it on spot. It's not the ideal. It does take up more time, but we will accommodate once you fall within that category. A teacher or the education system a tourism worker, customs, Department of Correctional Services, the Fire Brigade, Passport and Immigration and Citizenship Agency, and anyone 60 years and over. We say, get your jab, get your vaccine this weekend, starting tomorrow, at a site near you. Tomorrow, Friday, Saturday, Sunday, Monday, and Tuesday. So we have a fairly long period. We would like to see 50,000 persons being vaccinated or inoculated during this 4-day blitz. And we are making the public health system available to all of you who fall in this group. And the numbers are there. The numbers are there. What we need to do is to convince persons to come out. Now, I know the question will be asked about the shutdown this weekend based on the measures, the lockdown, Saturday 12 noon, and then all day Sunday. Well, the government, the Cabinet of Jamaica, in consultation, of course, have given a directive to the constabulary, the enforcers of the measures, to allow persons who are going to vaccination centers, who should have an appointment on their phone, who may have an ID to say they are 60 and over, or one of these work categories, working with a hotel or a teacher, who may have a letter from a JP verifying their age if they have no other forms of ID, that they are going to, or who is transporting such persons, would be allowed to go to a location, to travel to a location outside of those hours which are allowed for movement. In other words, you can go to your vaccination center at 3 o'clock on Saturday evening, even though the restrictions begin at 12, or any time between 9 and 4 on Sunday, even though it's supposed to be a no movement day. So do not allow the restrictions to stop you, because there are exemptions for this program to continue. And it is important that we continue the program. So that's a very important piece of information that I would like to leave with you. This is a national program, and we want to ensure that it is going to be successful. Now, you may also ask the question about the inclusion of the teachers and the tourism industry. Well, first of all, our teachers have a critical role to play in our education system. They're playing that role even now remotely. And of course, our hardworking Minister of Education has been providing all the critical support to their efforts. However, the desire is clearly to get our children back into the classroom and to have the face-to-face sessions. And our teachers, who are critical to that interaction, we believe represents a priority group that should be inoculated and have their 2 jabs. And remember, there is an 8 to 12 week separation between the first and the second. And so it is important to get them vaccinated now so they can get their second dose in 8 to 12 weeks' time, and therefore have the protection they deserve for when face-to-face should have resumed with our students, our children, which is so badly needed. And therefore, the decision to prioritize our teachers was easy. And this is the rationale. And in a minute, I will speak with the the president of the Jamaica Teachers Association around that priority and get his views and hopefully his endorsement and encouragement. Mr. Jasper Gabriel. The tourism sector, we believe, is one of many very important sectors in the economy. And, you know, the Prime Minister is on record of saying we have to always balance lives with livelihood. And the truth is, that sector is particularly vulnerable because it clearly caters to foreigners. We host our guests here who travel from North America or other places, and the exposure creates a risk level that is higher than normal, both to the internal tourism worker but to the environment. And we have managed to date to control that as best as possible through the creation of the corridors and so on, and the protocols within the hotels. Minister Bartlett has been very important to that, Minister Mackenzie also. But in anticipation of a vaccine program that is global, that ultimately will have an impact in North America, where they're going very fast in vaccinating their population, and which represents our primary market, and hopefully then increase in demand over time. We believe that a priority in this instance should be given to that industry in order to prepare that industry for full-fledged resumption of offering our beautiful land and services and people, and by extension, the economic activity which it represents. And so it's a call that we have made as a government, as a cabinet. I know not all will agree with it, but we believe that tourism is sufficiently important, and given the risk factor of inviting outsiders to come in, it's important that we position ourselves to do so, and do so safely. There are other groups that will come in the weeks to come, and so no one should feel left out. But this is where we're starting, and it's a judgment call, but I believe it's a good call, and we hope that those who are included will take up this offer to experience the Blitz this weekend and the weekends after. I will have Mr. Clifton Reeder, who is president of the JHTA, comment on that shortly. But first, President of the Jamaica Teachers Association, Jasper Gabriel, he's on sabbatical now, but he's the principal of one of the best schools in Jamaica. Can you tell me which one school is that?
Kingston College.
No, not Kingston. It's Manchester High School by Alma Mater, right? So, Jasper, I'm sure Manchester High misses you, sir. You've done a good job there. But now you're wearing a different cap. Welcome to COVID Conversation. Tell us about the decision that we have made and how you view the process, and what would you say to your members?
Thank you very much, Minister. Greet the CMO as well as Permanent Secretary and my colleagues. And just to confirm, Manchester is in great hands, man.
Okay.
All right. So from earlier, Minister, you would have known that I would have made an impassioned plea for teachers to be included in the priority group for vaccination. That was very early out. Not many members of the teaching profession were very impressed at that point in time, because it was quite early in the game. But as we kind of looked at what was happening globally, and the effects, especially that the COVID-19 is having on the education system, I thought that it was very important that, first of all, a space be secured for teachers while we continue to monitor the developments and persons continue to make their own decisions. And so the last survey we did about 3 weeks ago, the pickup rate across the profession was in the region of 62%. About 2 months prior to that, it was in the 30s. And so as time progresses, there is greater buy-in across the teaching profession. We also had Dr. Figueroa on one of our platforms with about 1,000 of our members, answering questions, taking concerns, and that would have gone a far way as well to allay some of the fears that exist. But from our standpoint as an association, teachers are highly exposed. In fact, one of the challenges we have had with face-to-face instruction is the fact that it's so difficult to control movement of students and gatherings outside. The issues we have are not so much at the school plans. The school plans are very well fortified with all the protocols and all that is required within the walls, but the students don't live there. They travel daily. and they gather in the plazas. And given the asymptomatic nature of our students, it means that our teachers are highly exposed. And to the extent that although we've been calling over time for random testing of students in schools, that has not happened. We understand the pressure that the Ministry of Health is under, and that would cause increased pressure. But we think that is essential. What happened at Monroe College still weighs heavily on our minds. Random testing there showed 80% of students in just 2 classes that tested positive, and they are heading back home to parents and traveling and transportation sort of thing. And so, like you have said before, I thought this would have been an easy decision. First, to include teachers in the priority group. Face-to-face instruction is critical until we can properly be ready for online instruction. A lot of work is going on that side. But certainly, especially as we prepare for external exams and as we are going to look to bridge the learning loss, it's going to be very important that we look to more face-to-face instruction in the short term. And so given that reality, it's very, very important that the option be there for teachers to get vaccinated for their own health and wellness. And the truth is, I've been encouraging our members. I'm looking forward to do the same. The truth is the risks of not taking the vaccination are far, far greater than any of the concerns that are existing surrounding the vaccine. And so we endorse the work of the Ministry of Health and the fact that teachers are included. And I know that as the days go by, the numbers are increasing as far as the number of teachers who are open to the vaccination is concerned.
What you said 62%. How many teachers would that represent approximately?
13,000 plus.
Okay, well, that's good. I mean, that's a good start. That's almost to the 2/3 number that we would have set as a target, and hopefully others will come in when the process starts. First of all, yes.
Just to be clear, though, so the groups that you have identified, so we have 25,000 teachers, and with all the other groups that you have identified, if you have a high take-up rate, do you have sufficient vaccines for the period mentioned?
We have enough for all of them.
Okay.
So you just as though you convince them to support you as president, I'd like you to convince them to take up the vaccine.
This one is much more difficult, but it's moving.
All right. Well, first of all, I want to thank you for the endorsement and for the support. And I share your views that it's important to give our teachers the protection. We share your view, the government that is, that they are a priority. And as I said before, we really want them to go through a process of getting their second vaccine so that the face-to-face resumption, it can be a seamless transition to really where we want to get back to. And so it really is a positive. Now, 13,000 is a good number if we can get that number out. The process of registering is going to be key. So we're going to encourage you to encourage your members through your own internal communication so that they go online and quickly register. They'll be given us a location closest to them. And it's pretty easy. The National Arena experience was very smooth, and we're trying to replicate that across the country. So really appreciate that endorsement. Any final word of encouragement before we close this segment?
Yeah, thank you, Minister. I know it's not easy at all. On behalf of the profession, we want to commend the Ministry of Health and all its agencies. It's been a tough time, the most devastating period in our history. The education sector is reeling from it as well. And despite the challenges that we have encountered, I think there is hope for a brighter day. We keep a very close eye on the positivity rate, because not so much the number of cases, because of course the number of cases is a function of the positivity rate. I heard CMO said we are looking to get that down to in the 5% region. So we have a lot of work to be done there. And the teaching profession, we are on board in terms of ensuring that we follow the protocols, ensuring that our young people also follow the protocols as much as is possible, and we are willing to continue to support this effort because it will also advance our national development.
Thank you very much, Mr. Gabriel. Thank you, and good luck to you, and thanks to your members and your executive for supporting this initiative. Looking forward over the next few weekends to get as many teachers as possible and members of the education system. Thank you.
Thank you. Blessings.
Okay, so that is a very important endorsement there, and we encourage all teachers and members of the education system to use this weekend to be a part of this blitz. We're going to move right into the next interview, and this is Jasper Gabriel. Sorry, we just finished Gabriel. Clifton Reader, sorry. How could I be making that mistake? I just spoke to you earlier this evening, at least a couple of times today. How are you?
Exactly.
How are you, Mr. President?
I am doing very well, and I must say that I must thank you and your team, because we've been agitating, making representation to move the tourism sector from July up to at least May. And we're very grateful, and I know that your team, working with our minister, our very hard-working minister, made it happen. And we are grateful for that.
Well, you know, the economy is very important as much as is the need for good public health practices. And, you know, we're at a delicate stage now, so it's really a matter of how we manage that process. I think Jamaicans have sacrificed a lot in the restrictions. And, you know, we have to also trust them to be a part of the process of recovery. And I think that's what the government, led by the Prime Minister, of course, is attempting to do. So tell us now, how many workers do you have currently in the tourism industry, and how many do you think will take advantage of this opportunity to prepare themselves for the recovery?
Well, the direct employed to the tourism industry is about 175,000. Currently, we probably have about 50,000 at work. When you look at transportation, you're going to be looking at the attractions as well, the craft. You know, we believe that we can at least turn out over these 4 days 15,000 or more. We have been mobilizing for a while now, as you know, through the PSOJ, of which we are a member. We signed a MOU, and we've been supporting the ministry over time, both with computers, with venues for different things. You know, so we've been working very hard, not just now, and we will continue to work hard to make sure that our people turn out. Just today, I met with our area chairs, because strategically, we can organize in every single parish, because we have area chairs, we have vice presidents of GHTA, and I must thank the past presidents. They've been very, very active in turning out people, making sure. So what we've done over the last 8 to 10 hours, basically, is to say to the managers, look here, just sign up as many people as you can on site. They've been sending in figures, and the moment I come off this call, I will have some kind of indication as to how many people will turn out tomorrow, and I'm sure even overnight it will be added to, because I understand the portal will be open for tourism workers tomorrow, and we will just have them sign up. Another thing I'm encouraging to ensure that people don't just say that they will sign up and they don't sign up is to get the HR managers on each property to register the people on site. If they're at work, we can pre-register them. You know, we can help them along the way to make sure that they just don't leave the property, no internet connection, or can't get on the site and decide not to show up. But you can be rest assured that our support is with you. We know that tourism contributes a lot to the economy, and our summer is looking really, really well. We are going to be getting more people in, which means more exposure for our people, and we're going to be bringing more people in from communities as well. So we have to ensure, yes, as you said, the corridors worked extremely well for us. The protocols, the mask wearing. We even set up something called the Ambassador Program, which we have mobilized recently to make sure they go out into the communities as well. And those people who are not at work, to get them into the system, registered. Because if you should look at it from a marketing perspective, some countries, you look at Cayman, you look at places like the Bahamas, they will be almost fully vaccinated by the time the American market is ready to travel. There's a pent-up demand in America, and they're going to want to go to countries with high vaccination rate. And this is why we're appealing to our people to get out there, get vaccinated, because it's going to mean the difference between running at 20% or running at 70% occupancy. And of course, it's going to mean that we will reduce the amount of people going to hospitals, the amount of people getting sick, and of course, the amount of deaths, which is extremely important. And we want to bring back our employees to work as well. We have too many people out there, some of them been out there for a year without a job. So we want to be able to bring them back. And this is one way. This is a passport, basically, to bringing them back.
So, Clifton, that's the key point. I was going to ask you a question, but I think you answered it. The relationship between vaccines being administered in your main market of the U.S. and the fact that once they achieve their herd immunity, their economy becomes more open to travel and for tourists, visitors to come to Americans essentially to visit other jurisdictions. And so it's important for us to position ourselves as also being a safe destination, starting with those who will treat with them when they arrive, which is the workers. So that's one, I think, critical link, which you have explained why it's so important. But also, very importantly, the impact of the sector in terms of the jobs that it creates, the multiplier effect on families, on communities, tourism clearly being very important to economic activity. So the efforts at applying the vaccine are linked in this instance, both to the protection of our people from a health perspective, but also from an economic perspective. And that is what the government is attempting to do. We're attempting, and have always attempted, to balance both of these very critical imperatives. And we're at a stage now where we have to look at the trends globally, see where we're headed, look at where the end may be in sight in terms of the heavy restrictions, and position ourselves to take advantage of the economic activity that we have depended on in the past and we need to get back. So, I hope that our people recognizes that. And it's not to say that other sectors, other industries don't require the same attention. Banking wants it, manufacturing wants it, retail wants it. All have benefit and will benefit if they are 60 and over as of now. But the targeting has to start somewhere, and hopefully over time it will build out. So that's where we are.
But Minister, when you look at the linkages that tourism offer, agriculture will grow when we start to grow as well. Manufacturing, because we buy a lot of things locally. So we have the potential to kickstart the rest of the economy as well, not just the hotel sector or the transportation sector or contract carriaging in general. But I think that with tourism coming back in a responsible way, in a safe way, we have to make sure that our employees are protected, our guests are protected, and by extension, our communities are protected as well. And the only way we see right now is for people to get vaccinated, and so that we can have a productive sector and get back to at least pre-2019 figures in the next year or so.
Sounds good. Now, you have said 15,000. Well, we look forward to the efforts of your leaders across the board. We are prepared to inoculate 15,000 if they, in fact, come out. We encourage them to use the the portal, the toll-free number, and the website to register, and we will give them a venue closest to them. And of course, we know we can collaborate to encourage the logistics movement to get them out. But this is for us important as part of the Build Back plan, and we want to commend you and the leadership, as well as your minister, Minister Bartlett, for being a critical part of making this happen. So thank you very much, and we look forward to a lot of activity over this weekend and in the weekends to come. Thank you. All the best.
Thank you very much. All the best to you and your team as well.
Okay, so that's Clifton Reeder, who is the president of the Jamaica Hotel and Tourist Association. Ladies and gentlemen, we are going to go right into questions now because I think we are really running behind time. But essentially, the blitz this weekend is really where it's at. I think it's important that the country recognizes the importance of it. Starting tomorrow, I think we're going to be at the arena tomorrow, right? No? Okay, well, starting tomorrow, the locations are already determined. Once you make your appointment, you'll be told of a location. Going into the full weekend and the new week, and irrespective of the restrictions, you are allowed to go and get vaccinated. Please, 60 years and over, tourism workers, teachers, and others, take up the opportunity. It's important. It's about getting back to life, to normality. And we want all to have equal access. All right. Petra, can we get questions, if there are any?
Okay. Members of the media are invited, as per usual, to use the raise hand feature in order to be acknowledged. And our first question this evening comes from Jamaica Social. Go ahead, please.
Are you hearing me?
We are.
Okay. Good evening, everyone. I'm Cassius Watson for Jamaica Social. Minister, there are clear concerns regarding the vaccine, which we have a pretty good number of doses of the AstraZeneca vaccine, and Jamaicans are looking very keenly at developments over the past, say, 2 days or so, where closer linkages are being made to the clotting and the controversy around that. Surely that will give Jamaicans second thoughts about doing this. Your thoughts on assuring or reassuring the Jamaican people that it is safe, and what impact you believe that will have? Thanks.
All right, well, I think that CMO gave about 4 or 5 slides on that, and maybe you need to put that slide up on the website, CMO, so that others can access. But she was very expansive, very detailed, and she can summarize it very briefly, just for your purposes.
Right. So, yes, we would have taken note of what is happening in Europe and in the UK, and we would have seen the reports coming out of the European Medical Agency, as well as the UK Regulatory Authority and the WHO. So there have been recognized to be these incidents of rare blood clots associated with low platelets that have been found in very few persons. So I want to emphasize that these are very, very rare incidents, and the benefits of the vaccine far outweighs the risk that there is. So we encourage persons to take the vaccine, and we have listed if there should be any side effects that persons experience, that they seek medical attention as soon as possible. But I want to emphasize that it's very, very rare, and this should not deter us from taking the vaccine, because the benefits to the individual as well as to the population far outweighs the risk.
Thank you. Next.
Thank you, Minister. Thank you, CMO. Our next question comes to us from Emma Lewis. Emma, go ahead.
Yes, good evening, everyone. I can see that the tourism lobby has been successful, but I am still a little concerned about some of our more vulnerable members of society. For example, how is it going in terms of prisoners, incarcerated people, and also people in elderly in infirmaries and private nursing homes, and also the disabled and people who are not able to leave their homes for whatever reason? Are we making sure that all those people are vaccinated? Thank you.
Well, I'm going to ask the peers to speak to the other groups, but let me just say from a policy perspective, Emma, one has to be careful that we do not give the impression, and maybe I'm sure that's not your intention, that the decisions around who gets vaccinated, and in this case the tourism industry, it is a function of lobbying. Of course, lobbying takes place in every society, and I'm sure the bankers are very powerful too, and I could go on and on. The government of the day deliberates extensively and in depth around the decision it takes around the vaccine program. And as you can see from the logo up on the screen, we are committed to the human well-being, the equal respect, the national equity, the legitimacy, and the reciprocity. Those are very critical components of the program, which is in keeping with the WHO mandate around this kind of thing. So it's really what we have said, that we are at a stage where we are building out a program to save lives, to protect the population, and to build back our economy. And I think that is a legitimate benefit to all, even if it starts with a particular area. Now, as it relates to the vulnerable communities, as you know, the program started with the over 75s, and we have included in that the infirmaries and nursing homes. We have brought on board, as we built out, support groups to help to bring persons out. So our blitz, for example, involves caregivers coming in. So because we recognize that some of these vulnerable individuals, by virtue of age, are not as mobile on their own. There is a phase to deal with other shut-ins. The reality, though, is that persons who are confined in their home space, outside of the institutions like infirmaries, tend to be somewhat safer than if they were exposed and are moving around or a part of a more institutional group. So what we will do over time is to build out to address some of those other institutions or other vulnerable groups. And what is the plan for the prison systems, the inmates in prisons?
They will be vaccinated they're part of DCS. So when we say DCS, we include
the correctional services?
Yes, Minister.
You want to just address that?
So I will ask Dr. Ennis to speak more definitively on the clinical management of other at-risk population. However, for the Department of Correctional Services, for example, Minister, when we say Department of Correctional Services, we are looking at all aspects of the Department of Correctional Services to also include inmates of the correctional system. And so we will be utilizing the resources over the next 2 weeks to vaccinate those persons who are incarcerated at this time. Dr. Ennis?
Thank you very much, PS. So we continue to vaccinate those most vulnerable. Please be reminded that we have started to vaccinate persons in infirmaries and nursing homes. They were actually in the first group. So most of our parishes have gone into these facilities and vaccinated. Now, we have had some refusals because the relatives of those persons indicated that they did not want those residents to be vaccinated. But as we continue to build awareness and encourage persons to be vaccinated, our teams will review and return to these infirmaries and nursing homes in order to vaccinate these persons. With regards to our shut-ins, we actually have a plan for them. We have been in dialogue with the clergy, the church, or private practitioners to get the numbers of persons who they serve who may be shut-ins. And once we have completed and compiled that list, we will move headstrong into vaccinating those persons. Additionally, one of our sites in Kingston actually facilitates the persons who drive through, and that is the Mona Aging and Wellness Center located on the University of the West Indies compound. So we have started in a small way, and we will continue with persons who can make it and stay in their cars to be vaccinated.
Thank you very much, Dr. Ennis.
All right. Thank you, Minister PS, Dr. Ennis. Our next question comes to us from Nora Gay Banton. Nora Gay, please go ahead. And if you could indicate your media house as well, that would be appreciated. Thank you.
Okay. Nora Gay Banton from 18 Degrees North. Are you hearing me?
Yes, we are.
Okay. Question, I heard the CMO mention that there were no cases of the rare blood clot and low platelets. However, are there any other cases of adverse effects other than the blood clots and low platelets? And how is the ministry recording these adverse cases, especially as it relates to the website?
I think Dr. Ennis had a slide that she would have put up in her, I'm not sure if she has it now, but we normally give, based on our audits of the vaccination program, the adverse effects report, which, doesn't it? Dr. Ennis, you want to speak on that? Dr. Ennis?
Yes, Minister. I wanted to share my slide. I think I have found it. Okay, sharing, and let's see if we can get from current slide. Oops. Oops, I'm not seeing my service, but hold on one moment. I'm not seeing the slide with the service, but just to let us all know that we have received approximately 54 documented evidence of adverse events. Now, we classify and categorize our adverse events as mild and serious events. Most of the ones we have received, if not all, fall into the category of mild and would be the usual side effects that are expected. However, we have noted in a few of the persons that the duration of these effects, for example, the rash, pain at the injection site, and swelling have extended beyond the typical 72 hours. And I believe we have on record just one person, which is something we would call serious, that developed an abscess at the injection site. And that too is one of the expected reactions, persons who would have same. So we have a robust tracking system. Now, every time we hear of something going wrong, it simply means that our surveillance system is working and working well, because we're able to identify any challenges that results from vaccination. So we have that system in place. We have our reporting mechanism, and we also have the investigation in order for us to try and determine if there is indeed cause and effect, that because you got the vaccine, then you have developed something. So that system exists. We have a national ISAVI committee which reviews the cases, give feedback to the field, and advise persons who may be involved in these adverse events.
Thank you, Dr. Ennis. Petrie.
Our next question comes to us from Zara Burton, also from 18 Degrees North. Zara, please go ahead.
Good evening, everybody. I have a couple of questions regarding the $10,000 to individuals. It was said over, I believe it's 60 or 65 who were getting vaccinated. I wanted to know why were they getting the $10,000? I wanted to find out if that could be articulated. And also, who is funding that? Are we getting any kind of, whether it's multilateral help, funding help from any of the pharmaceuticals, any of the PAHOs in terms of rolling out the vaccine program, and to what dollar value, if yes? And then, final question was, in terms of Deron Wood's death, what's the science with how you went about ruling out the vaccine as even contributing to his death?
All right, thank you very much for the question. We are not able to, from the Ministry of Health and Wellness, articulate the program for the cash benefit. The Ministry of Finance and the Public Service will provide more details on the implementation of that intervention. So we will be looking forward to that update from the Ministry of Finance in short order.
In terms of the deaths, I just follow up on what Dr. Ennis says. Pretty much after persons get the vaccines, anything that happened to them can be reported. No, it is the investigations of the committee that looks at it to see whether or not there is a direct cause from getting the vaccine. So you would have seen that if you look at the adverse events reported in several countries, there has been a lot of conflict about those reports because, in every country, you have this access to report, and so persons will report any and everything that happens. You now have to filter through that information. So with regards to the specific death that you would have mentioned, we have not received all the hospital reports as yet. So once we've received the hospital reports, then it would be reviewed by the committee.
Okay. Thank you, PS. Thank you, CMO. Our final question this evening comes to us from Debbie-Ann Wright of the Gleaner. Debbie-Ann?
Good evening. Yes, from Radio Jamaica, actually, but RHR Gleaner Group. Good evening. I wanted to find out whether you heard the news of the vaccine reports today.
We have a problem with the mic. We're not hearing you.
Are you hearing me better now? Hello? Are you hearing me?
Yes, we're hearing you now. Go ahead.
Okay, right. I've seen reports today that the African Union has decided not to go ahead with any more purchases of the AstraZeneca vaccine, given some of the reports of adverse findings or effects. Is that decision likely to impact our own vaccine program? Do you see any such thing happening? Also, Dr. Tufton, what's the update on the procurement for what's it called? To check for variants, because you were told that we were going to start doing that, and we're still awaiting results from CARPHA.
Okay, thank you. Let me deal with the first question, and then I'll have the CMO deal with the variant strains and the testing. I don't think we can conclude that a decision around AstraZeneca is based solely on the issues that have been raised around side effects. The CMO again spent a very long time responding to the issues around AstraZeneca, and it was quite comprehensive, I thought, and we have concluded based on how it has been administered, the side effects to date, and we remain committed to the application of that vaccine once it's available until there is further and better particulars. What I know is happening, certainly from our point of view and involved in the discussions with the African platform as a source for vaccines, is that there is an attempt at moving to a single dose vaccine as opposed to a double dose, which means the Johnson & Johnson, in fact, there is an agreement, as I understand it, for a significant volumes of that particular vaccine to be manufactured in Africa. I think 400 million in the first instance. And the decision, therefore, would be to move towards what would be a vaccine, certainly from our perspective, that would be easier to administer because we're giving one dose as opposed to two. And then, of course, you would recall that the South African strain was proving to be challenging for the AstraZeneca vaccine. That has been reported and has been supported scientifically. And so there would be a motivation to move away for that reason. But again, the single dose would suit Jamaica very well. So we are actually in discussions with the African platform, the Ministry of Foreign Affairs and Foreign Trade, as well as Mr. Howard Mitchell, chairman of the NHF, to negotiate having more of the Johnson & Johnson as opposed to some of the other brands, primarily because the single dose would give us a much better chance at efficient management of the process and, of course, to complete the inoculation program over a shorter period of time.
Thank you, Minister. Before I hand over to you, sir, for your final remarks, we have a quick follow-up question regarding whether we're in receipt of multilateral or other outside funding concerning the rollout of the vaccination program. I don't know if perhaps PS, you could take that one for us.
So thank you very much for that. At this point in time, the government of Jamaica is fully funding the vaccination program. Some $6 billion were allocated in the budget for 2021-22. And that those provisions in this financial year have already begun to be provided to the Ministry of Health and Wellness, and it's from these resources we are allocating support. We do, however, get technical assistance from many of our partners to augment what we are doing. We have to mention some, including PAHO. We have to mention the CDC and USAID. We have to mention our colleagues from various other multilateral and bilateral institutions like the World Bank and the Inter-American Development Bank, the IDB, for the work that they do in providing technical support to the government of Jamaica in our quest to become successful in ridding ourselves of this plight.
Okay.
Okay, we're going to squeeze one little one in. Debbie Ann, can you go ahead with your follow-up question?
Yes, thanks a lot. I wanted to ask in light of the developments as it relates to AstraZeneca, whether we have enough of that particular vaccine secured to be able to give persons their second dose? Because I remember that Dr. Tufton said that the plan is not to mix vaccines.
All right, so the mixing part of it, the CMO can comment on if necessary, but the the issue of the second dose, yes, we are making provisions for that. The next round or the start of the second dose based on those persons who received earlier would be early May. And we do anticipate getting additional supplies in April. So we are prepared to begin the second application in early May based on anticipated supplies that we will get. And yes, the decision has been to stick with a single vaccine or brand for the 2 doses, which again justifies why it would be best to have the single dose vaccine, which is a Johnson & Johnson.
Thank you so much, Minister. CMO, you wanted to add anything? No? All right. We're at the end of the Q&A segment. Members of the media, thank you so much. At this point, I hand over to our Minister for his final remarks. Minister?
Okay, thank you very much. So the time has passed and we're a little bit over time. I want to thank all of those who have been a part of this evening's COVID conversations, the CMO, the PS, Dr. Ennis, Pitre, and of course those who came on and asked questions. We hope that you are clearer now on where we are in this process. I want to thank our special guest, the President of the Jamaica Teachers Association, Mr. Gabriel, and of course Mr. Reeder, who is President of the Jamaica Hotel and Tourist Association. I think we are making some progress in the COVID response, even though it has come at a cost being restrictions. We're seeing our numbers now declining or plateauing. We are seeing hospitalization going down. We're seeing a reproductive rate going below 1, and the positivity rate also declining. And that is good. It's a good sign. Still early days, still delicate. We have to comply with the protocols still. It's important. We don't want to increase those restrictions. We want to ease those restrictions. That's what the government would like to do. But it means that we have to observe those critical protocols, which still represent the most effective response to date. In addition to that, the vaccine blitz is on this weekend. It's beyond the weekend. It's a long period up until Tuesday of this week. And tourism workers, teachers, and other important groups and the over 60s are encouraged to apply online to register, or the 8881 Love number to visit the site closest to them and to be a part of this very important initiative as we seek to achieve herd immunity. I want to thank the government and people of South Africa and the African platform for the vaccines that were received today, the efforts of the Ministry of Foreign Affairs and Foreign Trade and the National Health Fund, Chairman Howard Mitchell and Everton Anderson, and all others who have been part of this process. And I want to thank the healthcare workers who are going into this long weekend and will be working extra hours to accommodate as many persons as possible. Let's get it done. This is for all of us. This is about getting back to life and restoring and reviving our economy for the benefit of all Jamaicans. Thank you very much. God bless.
This morning I woke up and I look in the mirror and every part of my body was in place. Many people died and never saw this day. So another day I live, I appreciate